much for joining me today. My name is David Nutting. I'm a personal trainer, and I want to help you with some arthritis pain. Send this to anybody you know who has arthritis pain, because I think a lot of times what we're doing to treat it is not the way that you should be treating it. So I want to take you to first, what are the early signs and stages of it, what it is, and then the treatments that I think would work best. So early signs and stages of arthritis is going to be some joint stiffness, joint pain. There's going to be fatigue. A lot of times in the morning, you're going to feel that a little bit more. Anytime if you have swelling as well. Two types of arthritis mainly are the main common ones. The first one is osteoarthritis. It's called OA. That's the most common one. And that one is going to be more on the weight-bearing joints. So think of your knees, your hips. It's going to be usually on one side of your body, but it can be on both. A lot of times your body weight is going to wear on those joints. So that's going to be something we'll return to that could help a lot in that area. The other one is rheumatoid arthritis, or RA. Rheumatoid arthritis, it's a autoimmune disease, and so it's a condition where it's coming at and trying to attack those areas of your joints. And that's usually going to be on one side. It's also going to be, a lot of times you're going to see fingers, it's going to be wrists, it's going to be hands, elbows. It's not the weight-bearing joints for rheumatoid arthritis. Now, how do you treat these? Well, the first thing they are is they're an inflammation. So they're an inflammation in that area. We want to treat it by losing weight and with some things with nutrition. It's not always in a, in a Tylenol or an ibuprofen. That can help to reduce the pain, but the challenge with those are it's not actually getting to the cause and be able to really help you in the long term. It's really a quick temporary solution. So let's first start with the number one thing that I think would help is weight loss. If your body's storing and holding extra weight, especially with osteoarthritis on those weight-bearing joints, that's going to put a lot more wear and tear on the joints. So you want to be able to work with eating the right foods, getting some good exercise, and I have plenty of videos on my YouTube channel that can help on that. Hire a personal trainer near you, and that could help as well. Along with that, what foods we want to take in. So let's think of omega-3s. That's going to be able to help around the cell membrane. It's going to be able to help with your eyes. It's going to be able to help with your heart health. Be able to start work with some fatty acids, and that's good around the joints. Another one is boswellia, so that's a good superfood. Other ones would be turmeric and ginger, ginkgo biloba. Now with turmeric, that's one of the big superfoods that a lot of people have heard. But what you want to do is take it with a fat soluble. So you want to be able to have some good healthy fats with it. If you take it on an empty stomach, it's not going to have that same type of impact. So those are some things that would help. Another thing that helps is stress reduction. Relax and breathe, because if your body's storing extra stress, it's going to get inflamed and it's going to store up in those joints, in your muscles. You're going to feel more joint achiness and pain in those areas. Other things that help are heat and cold therapy. So if you think of any time if you see it where it's swelling or if it's red, just grab a simple little ice pack and be able to put a paper towel or a towel in between and just kind of let it sit and rest there. You want to do that for about the first 36 hours. In doing that, do it for about 20 minutes at a time and then take a break and then be able to return back to it. Outside of that, things like this can really help with heat therapy. So you want to heat it up in a microwave or get something that you can have for some heat and then just wrap it around those joints. Be able to put that on. It's gonna, these types are heat sensitive, and they're allowing you to be able to have some good smells with it, which is always nice if you enjoy that as well. Acupuncture can help because that's going to help with the meridians in between. And then a couple other things are the pool, so that's non-weight bearing, getting your body moving around. I'll include a video that can help you in that area as well below. And then the last one I would say is even just starting off with some basic exercises. So that will help, of course, with your joints, helping with your weight, as I was mentioning before. Now, the Arthritic Foundation or the Arthritis Foundation, they recommend 2 to 3 times a week to be able to get some strength training. Start with 20 to 30 minutes and just do one set of 8 to 12 reps. Do it where it's a really light weight. For men, 5 to 8 pounds is actually a good start. For women, 3 to 5 pounds. and then work off of that. If 12 pounds is too easy, you want to be able to start adding in a little bit more. Try to do a full body workout. If I do a push movement, I want to do a pull movement. And so we want to work a little bit through the full body. All those things are going to help to make a great difference, but I think weight loss, stress, eating those right foods, those different superfoods I was telling you, and I'll throw in one more food, pineapple. That actually helps as well. If you have not subscribed, please subscribe below. And I have plenty more videos that help with health, fitness, help to loosen you up. I'm here to help you day by day. Thanks so much for joining me.